Good morning. All right, so today for Health Nugget, I'm going to be talking about, hold on one second. Okay, I'll be talking about blood pressure. So I would like to give first a disclaimer here. I'm not a doctor, I'm not a nurse, I'm not in the medical field, even though I work in a hospital. So this is not medical advice. I just wanted to share an experience that I had recently, and I want to bring awareness, okay? So first I want to give a quick definition of what blood pressure is. So blood pressure is the force of blood pushing against the walls of your arteries as the heart beeps blood through the body. So it's measured in millimeters of mercury, and is expressed in two numbers, systolic, which is the highest number at the top, and then diastolic, the lower number. So what is typically considered a normal pressure reading is, for most adults, it's typically 120 to 80. But it's not like, and we'll see that there are some variations to this here. So this is a chart that some health professionals use. So depending on the age, there is some variation here, as you can see, to what's considered a healthy blood pressure. So the younger you are, usually 19 to 24, consider good blood pressure would be below 120 and below 80 or below 79. And then, older, like 50, 59 would be 129, 85 for diastolic, and 60 plus 134 and 87. So I was watching a video, an interview with a doctor in the UK, Dr. Sanjay Gupta. And he was explaining how sometimes a patient goes to the doctor and they see that the blood pressure is higher than what's considered normal, and they put the patient on medication. Now, a high blood pressure is not necessarily a condition. It's a symptom of something that's going on in the body. So what usually happens, according to Dr. Gupta, is the doctor gives a medication, the actual condition of the patient is not dealt with. And then the patient says, okay, I'm good. For example, let's say someone who has blocked arteries or has poor lifestyle, does not sleep well or enough hours during the night. All this or don't exercise, all this contributes to high blood pressure. If you continue doing those things and just take medication so your blood pressure stabilizes, you're not really dealing with the problem, and eventually you're going to have, consequences. And of course, in addition to that, the medication you're taking, there will be also side effects. So here are some of the causes of blood pressure. Genetics, which most of the case is not, but it does play a role sometimes. Age, and as you can see, as we age, sometimes our blood pressure tends to be higher, and that's considered normal. Poor diet, especially fats, oils, and fried food. All this contributes to high blood pressure. Lack of physical activity. Obesity, smoking and alcohol, stress, and chronic conditions like diabetes, kidney disease, sleep apnea. This is a major one. You may be very healthy, but if you suffer from sleep apnea, it may contribute to your high blood pressure. So some of the natural ways to lower blood pressure are eat a balanced diet, diet of rich in vegetables, beans. Beans are very good to lower blood pressure, and some other garlic is very good also. Reduce sodium intake. We hear a lot about this, that people who eat a diet high in sodium tend to have high blood pressure. So that's something to watch out for. Stress also. Regular exercise, very important. Here it says limit alcohol consumption, but if alcohol is bad for you and it's toxic to the body, actually you shouldn't limit, you should avoid completely. And get enough sleep. And one thing that this chart doesn't address is oil, because oil is very bad for your blood pressure. So some of you here know that about 2 months ago, I think now, I pinched a nerve when I was exercising at the gym on my neck, and I had this shooting pain on my arm. It lasted a whole month. And at night, I would wake up, I could not sleep, I could not exercise for a whole month. And then when I went, I finally, actually, before the end of the month, I went to my primary care physician. And when they checked my blood pressure, it was like 150 over, I don't know what. It was very high. So they had to check like 3 times to make sure that it was correct, because I've been going to my primary care physician for checkups for years now, and my blood levels, everything is perfect. So they want to make sure, and they said, well, because you are in pain, you're not sleeping, so that makes sense. But then a couple of weeks after, the pain was normal, and I started going to the gym, not as often, but I kept checking every day, and my blood pressure was still high. So I did some of this research, and then I'll share you some of the medicines that I took to lower my blood pressure. So the first one of them was beets. I ate raw beets with my salad. Beets are known for lowering blood pressure, and I'll tell you from experience, it's amazing. And it's really interesting how amazing God is. If you look at the shape, when you cut the beets, it's the shape of a heart. And it's good for the heart, I can tell you. The other medicine I took was walking and running. Now, if you're not in good shape, if you haven't exercised for a while, you can just start running. But walking, even if you walk, start walking slower, and then start, speeding up a little bit. So I did this for a week, just for a week. 5 o'clock in the morning, Alina and I go to the gym, we lift some weights, and then we go outside and we run for 15, 20 minutes. And I'll tell you, my blood pressure now consistently in the morning, afternoon, evening, whenever I checked, it's in the normal range. So again, it's very easy to sometimes just to take medication when you can do these simple things that have no side effects and will improve not only the issue you're addressing, but your health overall. So this is from Christian Temperance and Bible Hygiene on page 100 and 101. Nature's fine and wonderful mechanism needs to be constantly exercised in order to be in a condition to accomplish the object for which it was designed. We were designed to move. If we don't move, we are in big trouble. More people die for want of exercise than from overwork. Very many more rust out than wear out. And this is a well-known verse for us. Beloved, I wish above all things that thou mayest prosper in being in health, even as thy soul prospereth. So it's God's desire that we be in good health. And another verse, as I was putting this together, and I didn't add here, is that whatever we do, we should do for what? For the honor of God. So, I mentioned my primary care physician. He, even though he's not, I don't even know if he's a Christian, but his approach to health is basically what we believe. He has done a lot of research on lifestyle, and he promotes the lifestyle to his patients, and it's amazing. And he is very acquainted with the Adventist health study. So, and he knows I'm Adventist, and I think it was like 2 years ago when I went for my checkup, there was an intern that was working with him. So the intern came first to see me and assess me, and he said, "Oh, Dr. Reed said that you belong to this church and that you follow the principles and that you're very healthy and so on." So that was really a testimony, not only to him but to the intern. So I got to talk to her, tell her what my religion was and what I believed. So for me to have a normal blood pressure, and everything else is not just for myself, it's for God's honor, because He knows about the Adventist health study. If I go there, my blood pressure is through the roof and I'm dealing with all these concerns, I feel I'm not honoring God. There are conditions that are beyond our control, but sometimes we need to make an effort, is say, okay, am I glorifying God by eating this kind of food or living this kind of lifestyle? Because sometimes, I'll tell you, it's very tempting, not to go to the gym, not to go for a walk, but we have to see it's not only about ourselves. The main focus for us should be how we can best honor God. So I encourage you, check your blood pressure. We brought the blood pressure cuff if you want to check it today. And if not, I believe everyone should have one at home. Check your blood pressure and try this. Start walking slowly, drink a lot of water, make sure you take enough sleep, watch what you eat, and you're going to see the difference. And it's very exciting and encouraging. It makes you want to keep doing it when you see the positive results. May God be glorified by whatever we do.